How much loperamide should I take? If you have a sensitive stomach and are dealing with irritable bowel syndrome or colitis, you may be asking yourself how much loperamide is appropriate for you. Loperamide is a medication that helps slow down bowel movements and can be quite useful for managing diarrhea. This is especially true for those who experience diarrhea-predominant irritable bowel syndrome or colitis. Let's break down how loperamide works. It acts on the gut to slow down its movement, which helps make stools firmer and reduces the frequency of bathroom visits. You can find loperamide available over the counter and by prescription, typically in tablet or capsule form, with each dose containing 2 milligrams. For adults who are experiencing short-term diarrhea or have diarrhea-predominant irritable bowel syndrome, the usual starting dose is 2 milligrams taken right after the first loose bowel movement. After that, you can take another 2 milligrams for each additional loose stool. However, it is important to note that the maximum dose you can take without a prescription is usually 6 tablets or capsules, which equals 12 milligrams in a 24-hour period. If you have a prescription, you may be able to take up to 8 tablets or capsules, or 16 milligrams in a day. Always follow the instructions provided on the package or by your healthcare provider. For individuals with sensitive stomachs or ongoing conditions like irritable bowel syndrome or colitis, it is especially important to stick to the recommended doses. You should not use loperamide for more than 48 hours without consulting a doctor, unless your healthcare provider has given you specific instructions to do so. If you have a sensitive stomach or a history of colitis, you may find that even the standard doses of loperamide can lead to side effects such as constipation, bloating, or stomach discomfort. In such cases, it might be wise to start with a lower dose, like 2 milligrams once or twice a day, and see how your body reacts. Some people choose to use loperamide as needed, for instance, before a stressful event or when symptoms flare up. For those who experience ongoing or recurring diarrhea, some healthcare providers may suggest a maintenance dose of 2 milligrams once or twice daily. This is sometimes recommended for chronic conditions like irritable bowel syndrome or colitis, but it should always be done under the guidance of a healthcare professional. If your symptoms do not improve within a week, or if you notice new or worsening symptoms, it is important to reach out to your healthcare provider. Lastly, if you have a sensitive stomach or colitis, be cautious with loperamide. Overuse can lead to severe constipation or, in rare cases, serious heart issues. Always keep an eye on your symptoms and communicate with your doctor if you have any concerns. If you have a history of colitis, make sure your healthcare provider is aware before you start taking loperamide, as it may not be suitable for everyone. To summarize, start with 2 milligrams after the first loose stool, and take another 2 milligrams for each additional loose stool. Do not exceed 6 tablets, or 12 milligrams, in 24 hours without a prescription. For those with sensitive stomachs or colitis, consider starting with a lower dose and monitor for any side effects. Do not use loperamide for more than 48 hours without medical advice unless directed by your healthcare provider. If symptoms persist or worsen, consult your healthcare provider. This approach helps balance relief with safety, especially for those with sensitive stomachs or colitis. Always tailor your treatment to your individual needs and work closely with your healthcare team.